sitting there visiting, and one of the new board members heard us talking about this in-service that we were going to be doing for the community, and she says, well, we have like a $200,000 grant that's for medication assistance. And she says, why don't you talk to somebody and, see what you can find out about it? Was it you, Monty, that I emailed?
Mm-hmm.
I was pissed. I emailed Monty and I said, okay, so tell me what's going on, because here we're bringing St. Pat's in,
Right.
so that she can tell us about medication assistance and help these people in our community who need the help. And why is it that you have a $200,000 grant that you're sitting on here and nobody in the community knows anything about it? Beth Price, who works for the Area 6.
So we don't have that. Do you
But
know that?
well, now let me finish. So Beth Price, who works for the Area 6 Council on Aging,
Right. We
she
just were with her today.
called, and the night of our meeting, I got an email from Holly. And Holly said, yes, that you do have a $200,000 or $250,000 grant that is for medication assistance, and that they just haven't got it off the ground yet, but, in the next couple months, we'll be hearing something about it. We've never heard a word. Beth has never heard a word.
We don't have that. So one of the things that happened, and you know that more than I'm giving you the bird's eye view from someone who walked in after
3
you
weeks
took
ago.
care of the hard stuff. You already took care of the hard stuff. So I came in and they were so misled about things when they became an FQHC that people in the kindness of their heart were saying things that aren't true. So what we got, I have all the records, and I will go back and make sure there's not something hidden, because I am learning something new every day. Okay, so I am just telling you, Monty, if there's 200,000 somewhere, I'm not going to be happy that week 4.
And I have an
about it.
email.
Okay.
Mm-hmm.
Here's what happened. We were allocated to become an FQHC. So Larry just told you about rural health clinics. So the difference between, in simplified terms, this would be a couple-hour discussion, but it's simple. Rural health clinics came about so that they could get a certain rate on Medicare and Medicaid, so they could stay open in rural places, just like tiny hospitals called critical access hospitals.
Which we are here.
Yes, we are here, and in lots of places. There's only about 10 hospitals in Montana that aren't. Almost all of them are, okay? And the issue behind that is, how do you stay open when there's hardly any people in our county? How do we do that? Well, Bacchus specifically, who's been around, helped at the federal level getting reimbursement rates to keep those two things open. FQHCs, federally qualified health centers, are in some other small towns just like this. I happen to have run some in some other towns. Here's the difference. Now you get a grant that allows you to offset some of the uninsured costs. Because until January 1, many people in our country, especially Montana, did not have health insurance. Not because they didn't want it,
20%.
but because they couldn't afford it, right? We don't make very much money in Montana. We live fine. Some of us. Some of us have a hard time, but we live fine. We don't make much money. So it says, we will make sure that people who are on low income have access to health care. And in doing that, the feds say, show us the need, we show you the poverty, and that there's nothing happening here. We don't really know how it happened. I fell off my chair, just like Jim, when Mineral County got the FQHC grant.
Yeah,
Fell off my
so
chair.
did the CAHs around the state.
So, but you got it, and so you say, hooray for you. It's a gamble. You guys won. Way to go. So what that means is that when you open your doors, we opened our doors 10/6 of 12. That is the official opening date of an FQHC here. You happen to have been a different color on 10/5, and you turned a different color on 10/6. So you went from a blue rural health clinic, it's a nice color, and now you became an FQHC turquoise. But what you got is a grant. So how your people interpreted this is they're saying things, we have a bunch of money, we can do Medicaid assistance. That isn't what the grant says. The grant says you have this amount of money to make sure health care is delivered, and in fact, the big things we're not doing like we should be, but now we're in a financial crisis, so it's going to take us a while to get there, is we're not doing the kind of oral health services we're supposed to be doing. As public health, first person I talked to when I was here, though I haven't gotten to see her since, because I've been buried, is we're not doing our oral health work, and we're not doing our integrated behavioral health work, right? And we're not taking on the patient assistance work that we could have from day one, nor are we taking on the malpractice issue that we could have taken to minimize our costs. There's a lot of things that got swirled around in that leadership issue going on. These were good people. In their heart, these were good people. But at a leadership level, they were taking on a lot of things that they got, within 3 months, they won the jackpot in 3 different categories. I mean, I was in DC the day the innovation grants was announced out here, and I called everyone I knew here to go, did you know about this? And they go, no, we don't even know what's going on. People were dumbfounded. But again, you won the jackpot. So we're there. We took care of last year. We're there. We're stable. We're stabilized, and we're going to go forward. So medication assistance, there is not a separate grant. We have 340B access, which is access to pharmaceuticals that are cheaper than full pay, that we have not opened up yet. I just read the email again today to work with the local pharmacy. That still will not get rid of the need for medication assistance. We used to run big medication assistance programs in Dillon, Montana, Sheridan, Montana, and Butte, Montana. Even with our grant, we'll need assistance. You know it's the biggest burden we have with most people, right? How do I pay for my meds? So I'm sorry you were given misinformation, but there is not 200,000 stashed somewhere for that. We don't have it. What should have happened is they should have said, is that a concern of yours? It's a concern of ours. How do we do this together to maximize that no one falls through the cracks in our community, right? You guys are on it. We just didn't, somehow that connection didn't happen in the right way. And, you know, I'll apologize for the sins of the forefathers, but we got to start and get to
Yeah,
it.
just another quick comment about, grants. So I ran a project for the Hospital Association for 20 months, about 3 years ago, that worked with real small critical access hospitals. It took us several years of working with the feds to come up with this small amount of money to kind of develop a new model. Well, number one, you never ever want to get involved with a grant like that unless you know that it fits. Unless you know that it fits. And I can't remember where I was when I heard that Superior got this FQHC grant and the CMMI grant, and stuff, but I was equally as dumbfounded, and my first thought was, that, especially the innovation grant, I mean, it's going along, it's doing its thing, it's a very, it's doing what it needs to do, certainly, but it really doesn't fit very well in a community of this size for a guy who's been hanging around small rural hospitals for 32 years. It just didn't fit right. And, I think the community is a victim of that. And all we can do at this point is just move forward. Move forward.
What about that? I read in the paper $130,000 of misappropriated grant money. Where's that coming from?
So here's what
The
that
vehicle
means.
and towers.
So let me tell you what that means in the world of grants. First of all, it wasn't misspent, okay? Meaning this board, they sit on it, we have paid all those costs. What it means is that those costs, when it was used for this specific grant called the Innovation Grant, was not allowed in the scope of that grant. But in the organization, we took care of it over here. The car, the Subaru, just so everyone's first public, do you mind if I say this, board? The Subaru is for sale. It is $24,000. It was $31,000 when it was bought, and it is a nice Subaru. I have the exact same one, only not as cool.
We can
model.
take 15.
It's going price, and I think we can sell it in a month. It is a beautiful vehicle. Never should have been bought.
They better not make that offer again.
That's right.
Oh, we'll talk then.
So misappropriate means in that
I know, they weren't supposed to purchase things out of
for
that.
that innovation. But it did not, it's not wandering around and we took it out of John's pocket to pay for it, right? In our big organization.
Nothing illegal was
No.
done.
So we had
It's
to,
just misallocated.
we took care of it.
Misallocated.
Are we happy to have done that? Not really.
Yeah.
Okay. But we took care of it. We're fine. We're fine. And I have to tell you, the people working in the CMMI grant, which is Center for Medicaid and Medicare Innovations, are incredibly committed and are working their little tails off. I am very involved with what's going on in oversight with that grant. We have lots of oversight, and John, in fact, as a board member, has been involved in it a lot. But I was a little skeptical because I knew a lot about it from outside, and when I came in, I'm quite impressed with the caliber of people working on that, and we are driving that, and the feds are with us. So we are so in sync with what the parameters are now. And remember, it's 3 years. It will be gone. There will be nothing left of that. It's an experiment.
Years ago, when we would apply for grants over at the county, you know, if you might not ever get another grant. If
Right.
you know, it was,
Well, these are brand new in the United States. That's why
Right.
that's why most of us were watching it and fell over when Montana got two.
Right.
They got one in Superior, one out of Billings. It was based out of California. Anyway, you know, it just kind of blew all of us out of the water. So these won't continue on. I mean, they're just an experiment from Centers for Medicare and Medicaid. So that's where that went.
Okay, so I have another question. So the van is
What is
gone-
the van?
The van,
The bus?
the bus.
Okay.
The bus is
Larry,
gone as of
that's
Thursday,
you.
right?
It is. It
So
is.
will you be applying for, I mean.
We'll apply for another one, but to be used only for patient transport, you know, at the nursing home.
A small
will it
bus,
require a
small bus.
CDL license?
No,
No.
no.
Only if you have one, Shirley. Only if you have one.
Only if you have one.
Yeah, Madeline, actually Madeline and I were the ones that got the hospital bus that you have right now. So,
The first one.
the first one, the
Yeah.
one that's got, that we've got through.
Does it have 200,000 miles on it?
It's got over 200.
So just so that you that are interested, there is going to be a transportation meeting to talk specifically about what are the real needs, which will be on Tuesday, the Tuesday before
26th.
Thanksgiving. Because
John.
it's an issue everywhere, right?
Oh, man, that thing drives by my house, I don't know how many times a day, and it is empty.
Well, right.
Well, it's stopped
You know,
now.
I've only been here three weeks, but on the last board report, you know, Monty put a little board blurb in, you know, for the hospital board. And, you know, and you did some, you know, promotion of the imaging and, you know, the mammography, the new mammography machine. And it was going down to St. Regis and DeBorgia, I think, to, you know, pick up people. And, you know, went down there three times a week for a little while. And Monty, you know, summed it up very nicely. No takers. No takers.
Albertans never used it.
So, you know, faced with that, that was one of the first things certainly that we looked at on the hospital side. We were hemorrhaging cash. You know, John Updike actually ran the numbers for us. And we were losing $2,683 a month, right, John? I think, do I have the number right? Pretty
That's
close?
right. That's right.
My old ball brain works sometimes.
Yes.
You know, so, you know, and the other thing that made us feel a little bit better about that was that the bus driver already had. he-
Open his own new business.
He had seen the handwriting on the wall, I think, and he already has other plans for other employment with his cleaning business, so.
You bet.
I'm on Buckle Up Montana
Yeah.
committee. We put in 2 child seats in that bus. They're worth about $75 a piece.
We'll get them out.
So John, will you
Can we
load
get 'em
that?
out?
Yep, you got it.
Let's get him out.
All right.
That and the radio.
Yeah, discuss that with Julie today, Julie's
Thank
got.
you.
Great, good catch. Sir?
Yeah, I have a question for you, Cindy. Back to the clinic. You wanted the trust of the community, and just as an example, last year, I get these pools anyway, but I have to go in and get a Z-Pack because they go into my lungs, and I've seen one physician assistant, one doctor, $132. Just fine, they were only quite. Then this year, I just went here a couple, 3 weeks ago, and it cost me $241, and they didn't even turn on the computer to see my records.
Did you call me?
No, I went over billing, and they said they'd look at it, and I got another bill for the exact same thing.
You need to, would you please put your name and number here so I can get a hold of you? Take care of that. So what's happening in billing is, we went to a billing service. I'm not gonna keep that billing service. I'm gonna bring things so that I can take care of that with our employees like that. And now that's gonna take us a little bit of time here, but that's one of our plans. It's very difficult. from my point of view, and the board would have to jump in, but it's in our preliminary plan, Lloyd's seen it the most, and Bill, about getting that back in-house so that the jobs stay here, number one, and that the training stays here, and so that when we get a customer telling us something that we did wrong, because we will continue to do some things wrong, but we better not be doing it at the rate we're doing it now, right? We'd like to be perfect, but, I'm too old, we're not gonna get there, but we're gonna get way better. So when I get a call from you on something, I don't have to then, chase it. I want to be able to take care of it right away. I now can do that. That's one of the first things I can do that. I can make sure that happens. But once those jobs are back in our little clinic, it'll be even easier. But give me your name and number. I mean, this will get taken care of tomorrow. Or how about someone who hasn't?
On a positive note, please. Oh,
That's sorry.
Go ahead. Oh, on a positive note, 6 months ago, I needed my blood pressure medicine renewed, and a well checkup. And it took me over 3 weeks to get an appointment. A week ago, or 2 weeks ago, I guess it was now, I called on a Wednesday, and I got an appointment on Friday.
Oh, thank God.
Not only that, the next day, on a Saturday, I got a follow-up call that wanted to know how my appointment.
Yes, we have instituted that.
Cindy's been talking about
I
that.
was very pleased with that.
Okay.
Somebody cared
Yes.
enough, wanted to know if I was taking my blood pressure, wanted to know if I was logging it.
Whoa.
Thank you.
Do it right and do it one better.
And one thing, if I can pipe up and say something, is it took a long time for the processes to get where they're at. It's going to take time to build those back up. I've been working diligently since I've been here. It feels like I've been here like 5 years, but it hasn't.
Cindy
It's
and
been
I have
about
been here 2 or 3.
Yeah. It's been about 7 months. So, the hope is that we can continue to build our processes, give better timely service, great quality care. And when you come in for your sore throat, we're probably going to check you for your prostate also.
Bend over.
At some point, we are
Only in our
we're currently working on, building some processes that you guys will start seeing where you're gonna have nurses calling you before your appointment, so that we can make sure all of your needs are met. Make sure that we're seeing you for all the things we need to see you at that appointment, and we have all the tools to see you when you get there. So you guys are gonna start seeing that. Again, we won't be perfect at that for quite some time. It's gonna take a lot of time. We're in baby steps. So, I'm hoping we can get to the point with the community that we earn back some trust. You guys are seeing the quality care you want to see. Rome wasn't built in a day. It took a long time for it to get to the point where it's broken to the point it was broken to. And it takes a while to build those back up. So my assurance, I know that's my job and that's what I'm
I feel
working
real
on.
comfortable coming in to see you because I don't have a prostate. Mine's already been removed.
We'll find something else.
He's got a sore throat.
I just want to make a comment, and I'm sorry, my voice is kind of hoarse. I've been the public health director here for 17 years, and this is the first time